What happens if hip arthritis is left untreated? I get asked this questions and other questions like it all the time. Other questions I get like this are, will the hip arthritis heal on its own? Can I live a normal life with hip arthritis? How quickly can an arthritic hip deteriorate? And how long can you last before hip arthritis requires surgery? Let me answer these 5 questions for you right now. The first question is, what happens if hip arthritis is left untreated? Well, assuming that the root muscle imbalance is not corrected, then the hip joints will continue to progress over time. The arthritis will worsen as time goes on because that root problem where the ball and socket joint, there's a muscle imbalance. There's usually muscles in the front of the hip that are too strong, and then muscles in the back of the hip, the glutes, that are usually too weak. And if that persists over time, then it's going to put bad forces, bad compression forces through the hip joints. And over time, you're going to feel worse. Now, there may be times where it improves because you get off of your hip, you reduce your activity, you reduce the irritating activities, and so it actually feels better. But then once you get back to being active again, and you're rubbing that hip inappropriately again because of the muscle imbalance, then it's going to progress the hip joint. It's going to injure the cartilage more, and over time, it just gets worse. And it's just a matter of time before people reach that threshold where the cartilage becomes damaged enough that it changes the motion in the hip. People lose motion, or they start getting locking in their hip joint because the surfaces of the hip joint, on the socket side and on the ball side, are no longer smooth like they should be. And so it affects the motion of the hip, which then affects your whole life. You can't walk normally, you can't get in and out of cars or get up and out of chairs normally. Everything changes at that point. And that's when a hip joint replacement is typically needed. But it's not uncommon, it happens all the time, that people don't get to that point where the cartilage is so damaged that their motion is lost, because there can be very severe pain leading up to that. Even if you don't have losses of motion and joint locking, people can experience severe hip joint pain and be trying to do things to help it, but they're doing the wrong things, or things that just have temporary relief that provide short-term improvements. And if the pain gets bad enough, a surgeon might give you the okay on replacing the hip joint if you choose to do so. Question number 2 is, will hip arthritis heal on its own? Now, if the hip joint can maintain its full range of motion, or as close to it as possible, then there's excellent potential for that hip joint to heal and for that person to get back to doing normal activities for the long term, assuming that the root muscle imbalance is corrected so that we're not putting bad compressive forces through the hip joint. But when I think most people are asking this question, they're not thinking about the root muscle imbalance, because that's something that I usually bring up to them as new information. They're usually asking the question from an angle of, if I just rest it, if I just don't do anything that hurts, will it heal on its own? And like I said earlier, it can calm the pain down if you do that. If you just don't aggravate it, it will tend to feel better. You may even get to the point where it doesn't hurt at all. And simple activities like walking around your house, doing your daily things, you're going to work, that kind of thing, don't bother you. But as soon as you try to do something that's a little more active and it requires more effort from your muscles and puts more strain through the joint, and because the mechanics in there aren't great, then it's going to re-aggravate it, and it's not going to finish healing on its own. You're going to re-injure it. And it's this process of re-injuring it over a period of months and years, even decades, that people get to the point where they slowly wear away the cartilage or injure the cartilage, and then they hit that threshold, that point where they say, okay, it's time to have surgery. This hasn't gotten better over the years. Each time it gets worse, it hurts for longer and more intensely. That's when people hit that point. But if you go through the process of treating the muscle imbalance, correcting the imbalance so that the forces through the hip joint are normalized, and you're putting the normal motions through the joint, and it's not in a way that's irritating it and aggravating it every time you go to do your activities or go exercise, go on a long walk, be on your feet for longer than you might normally do, then you're going to allow your hip joint to be healthy and normal for the long term. But you have to fix that muscle imbalance in order to create that healing environment for that cartilage to be as healthy as possible. Now, I've got a successful treatment approach that corrects this muscle imbalance, and I've packaged it all into a program called the Hip Arthritis Recovery Program. It's a comprehensive plan that walks you through all the stages, all the phases that you need to go through in order to get the hip feeling calmed down, getting the pain down, and then improving the strength in the right areas to flip that imbalance to create the right pressures through your hip joint and allow it to heal for the long term. This is essentially fixing hip arthritis so that you can avoid having a hip replacement surgery. I've been using the same approach with the clients that I see here in my clinic, and they have successfully gotten off the schedule to have a hip replacement surgery and gotten back to being very active, walking their dog as long as they want, going on long walks for exercise, sightseeing on vacations, walking through department stores for as long as they choose without their hip problem coming back over and over again. You can learn more about this hip arthritis recovery program through the link in the description below this video. The third question I get is, can you live a normal life with hip osteoarthritis? Well, if you fix the muscle imbalance, then absolutely yes, you can. I see people do it all the time. I help people do it all the time. It's extremely possible as long as that hip joint is not too far gone. As long as the ball and socket, the surfaces of the joints, are decently normal. There's some cartilage there. I don't want to say that. As long as the surfaces of the ball and socket joints are decently normal and they're not too worn down or shaped funny, because over time the bones actually change their shape. Around the bones, around the joint, you actually change the shape of the bones. You get things called bone spurs, and those things can affect the joint, the way the joint operates. That might need surgery. But for 9 out of 10 cases, really more than 9 out of 10 cases, people have not gotten that far. And there's excellent potential for them to heal their hip arthritis so that they can get back to doing normal things. Now, medications and injections are often used to treat hip arthritis, and they can take the pain down, maybe even take it away completely for a short time, but they don't change the muscle imbalance, the way that the pressures are going through the joint. And surgery can cut out the ends of the bones. They replace the socket and the ball with artificial parts, so that you no longer have arthritis technically. But the muscle imbalance is still there, and often it gets worse through a surgery because of muscles that have to be cut. And so people start to compensate and use those over-dominant muscles even more in the recovery for their surgery. And this leads to other problems besides hip arthritis. You might get hip arthritis problems in the other hip if you haven't had that one replaced yet either, or you might get knee problems or back problems as a result of this muscle imbalance. Then some people talk about regenerative medicine, which is things related to stem cells and like PRP, platelet-rich plasma injections. And these concepts are interesting and in development, of course, and the idea with this is that you can regenerate new cartilage cells where you may have lost some within your ball and socket joints, and that's fantastic. I think it's a great concept, great idea, but if the forces are still not good at the hip joint and you're over compressing the joint, then you're going to damage or possibly kill any sort of new cells, new cartilage cells that are being grown in your hip joint. So it is not a good long-term solution. You need to fix that muscle imbalance. Question number 4 is, how quickly can an arthritic hip joint deteriorate? This question has so many different answers because it depends on the individual. There's so many different factors that can influence this. And there's no consistent amount of time that any healthcare provider can tell you, like, well, once your first diagnosis happens and it's 6 months or 6 years, or it's rare that somebody can tell you. All they're doing, if they do give you a recommendation, is they're going off their experience and seeing somebody like you and thinking, well, this person had a hip replacement at 2 years after I first saw them, or 6 months after I first saw them. And they're considering factors like their age could be an issue, their weight. If you're very overweight, that could add more pressure to the joint. Your history, your family history, like if you had parents or grandparents that had hip arthritis problems or maybe had a hip replacement surgery, then that predisposes you to having one, especially if you went through a similar lifestyle as they had. Another factor is your strength previously going into having hip arthritis. If you're an individual that's generally stronger, then usually they tend to do better in not having a degenerated hip joint. But there's the flip side of it too. If you've been exercising a lot and you have a massive muscle imbalance, then you might hit it sooner. You might actually get your hip joint deteriorated faster because you're wearing into it faster. And weight isn't the whole picture. There's skinny people that get hip arthritis, And I think that's possibly related to not being strong enough, or maybe even a sedentary lifestyle. People that are sedentary are compressing their hip joint, not getting that motion in there, and so the joint's not very lubricated, and it just dehydrates the cartilage inside the joint. And so that sets them up to have damaged cartilage in the hip joint. I can't tell you how many people that have jobs that are, considered white collar, like attorneys, lawyers, bankers, financial people that have come in, even healthcare professionals that just sit at a desk most of the day, that have come into the clinic here and they're having hip joint problems related to them being sedentary. As soon as we get them on an exercise program that addresses the root muscle imbalance, then they can tolerate sitting all those hours. But when they're sitting and not doing the right exercises, then it's compressing the joint too much and they're not getting enough movement, and it sets up the deterioration of the joint to progress much faster. So given all these conditions, I have seen people as young as in their 30s have clear signs of hip arthritis. And then I've seen the other end of it where people come in and they're in their 80s or 90s and they're telling me that they're just barely having hip problems for the first time in their life, but it's still related to similar problems that I've talked about here. Question number 5 is, how long can you last before you need a hip replacement surgery? Once you've been diagnosed with hip osteoarthritis, the very next thought is, how long do I have before I have to have surgery? And it's perpetuated, it's kind of pushed forward by what doctors will often say, because they'll give a recommendation to the patient. They'll say, well, I predict you might last a year, you might last 2 years or 5 years before you need a hip replacement surgery. And they're taking all those factors into consideration. They're looking at you, they're looking at your health history, they're guessing based off their experience and working with other patients that are similar to you, and that's why they make that recommendation. And what surgeons are banking on, because this is what they usually see, this is the process that happens in front of them, is that individual that they're predicting, a certain time frame for them that need a hip replacement surgery, that they're going to try injections, they're going to try any sort of medications. They might try like stem cells or PRP injections. They might do physical therapy and do exercises, but they'll blame it on age. They'll say, well, they're only going to get older, your hip joint's going to wear down more, and it's just a matter of time before you need to have a hip replacement surgery, because the other 10 people like you that I saw in the last year went through the same process. So if you change that by addressing the root problem, which isn't done by medications, by injections, by regenerative medicine, PRP stem cells, and definitely not by surgery, and even physical therapy doesn't usually address the root problem, because physical therapists are used to seeing patients that have had a hip replacement surgery. They're helping the people that are recovering from hip replacement surgery, and they don't specialize in helping people prevent the hip replacement surgery. It's a whole different process, a whole different line of thinking and specialty needed to help that individual. So that's why oftentimes exercising in physical therapy doesn't have long-term results. It may help in the short term, but then it's often that you hear people say, well, I did physical therapy, worked for a while, then it got worse. So you need to address that root problem. So go check out that hip arthritis recovery program. And if you want to learn more about hip arthritis, I've got tons of videos here on YouTube. I put them in a playlist for you. It's called the Hip Arthritis Help playlist. It's in the link below. You'll find it near the link for the hip arthritis recovery program as well. Hey, thanks for watching. If this video was helpful for you, give us a thumbs up. Please share this with somebody you think needs to see this. Don't forget to subscribe to our channel. We find that a lot of our views on YouTube here are coming from people that are not subscribed to our channel. And we want to make sure that you don't miss out on any of the helpful information we post every week. So if you hit that subscribe button and turn on the notification bell for our channel, then you won't miss any of our videos. And please leave a comment. If you have any questions, we love to answer our comments and help you as best as we can. Thanks. I'll see you in the next video. Bye-bye.